What experience do you have with Microsoft software such as Microsoft Office, Excel, Windows, and medical software such as eClinicalWorks, EHR software, and Epic Systems?
I have experience in Microsoft programs. Um, as a receptionist, I was constantly working with Microsoft Word and Windows um, by entering information and organizing paperwork. And then as a barista, we had a digital register system that we used. So I'm familiar with adjusting to new technologies.
Cool. Tell me about a recent technology change in your workspace and how you adapted to the change.
I feel like I adapt pretty well. As a barista, we had a new order system change, and I had to quickly learn the new system. And then as a receptionist, we were constantly changing our scheduling system, so I had to adapt to that as well. With that, I feel like I stay pretty patient and open-minded, and I ask a lot of questions when learning a new software so that I understand it right away.
Cool. In the case that a patient is in a lot of pain, confused, scared about what's going on, and starts to take their frustration out on the employees, how would you handle this scenario with compassion and understanding while still keeping your professionalism?
I try my best to stay calm and be kind and professional. As a waitress, sometimes you deal with customers that are impatient or frustrated. So I learned how to listen to what they're asking and do my best to accommodate them. And then as an EMT, I learned that pain and fear can do a lot to somebody. So over time, I learned how to be patient and understanding towards people.
Very good. What strategies do you use when communicating in person or over the phone to ensure that you're being clear and understanding?
I do my best to communicate clearly and make sure that the person understands what I'm talking about. Such as when I was a receptionist, I'm constantly answering phone calls, answering questions, giving out information daily. And then as a barista and a waitress, I also are taking orders. I'm giving recommendations, types of things like that. So I make sure that the person is understanding what I'm saying before they leave. With that, I feel like communication can go a long way. So I do my best to communicate efficiently.
Awesome. What strategies do you use when communicating in person or over the phone to ensure that you're being clear and understanding?
I tend to use the ManageUp system, the communication system. All that means is that I'm communicating with my higher ups and making sure that I'm basically giving them a little play-by-play of the day and making sure that they're aware of anything that comes up wrong throughout the day. I was given the responsibility handling a lot of money and important tasks, being a waitress and a barista. And anytime money came up short, I made sure to let my supervisor know right away. On top of that, I'm always on time and I make sure not to call out unless it's an emergency.
How do you make sure that you are paying close attention to details and staying organized while looking after multiple patients?
I try to stay organized and double check my details. You're constantly handling many tasks, so I try to make sure that I'm very detail oriented. When you're a waitress, you are taking orders, you are taking payments, meeting customer needs. So I've become familiar with making sure that I'm staying organized and taking care of every task that is given to me. Also, as a CPR and EMT student, you realize that a lot of the small details are what's important.
Awesome. Are you able to prove that you've obtained an RN license? Is it active and in good standing? And are you in good standing with the State Board of Nursing?
I'm not an RN license. I am not an RN yet. But I am actively working towards that career goal. At the moment, I am CPR certified and EMT certified, and I have completed the courses, and those have taught me those have taught me the medical basics and have taught me patient care. So
Sure.
that is the experience that I have so far.
Cool. Okay, imagine you're working a busy shift and one of your patients is showing signs of distress, another patient's family is demanding answers, and your doctor is requesting an update. How would you handle this situation safely and efficiently?
I try to stay calm and focused when things get busy. As a barista and a waitress, you are working through, rush hours, long lines, hectic times. So I try my best to prioritize my tasks and stay calm. And I work hand in hand with my team to make sure that we are all reaching our tasks. And then as an EMT, I'm also taught to stay calm during emergencies and hectic times.
Can you describe how you manage your time by planning and organizing your tasks during your shifts to make sure that nothing gets overlooked?
I manage my time by planning ahead and making sure that I stay organized. I do things such as like making a checklist just to make sure that I'm reaching all my tasks before the end of the day. Being a waitress, you are dealing with tables, orders, payments. So there's a lot going on. So you always want to make sure that you're taking care of what needs to be taken care of in that exact order. And then receptionist, you're handling phone calls, you're scheduling appointments, you're handling paperwork. You want to make sure that you are doing that as well. So a checklist really helps with time management skills.
Good. And last question here. How do you handle conflicts or disagreements with colleagues or supervisors?
I would say that I handle them pretty calmly and respectfully. In busy times and workspaces, sometimes there's a lot of stress going on and disagreements can happen. I try my best to listen and try to find a solution instead of arguing.
Awesome.